Hello and welcome to the Vol Performance Online Workshop Series. Today we're fortunate to have David Spithill join us. David works as a physiotherapist in Melbourne and in private practice, but also is a physiotherapist with the Essendon Football VFLW team, hopefully to be an AFLW team in the coming seasons. And we're really excited for what David's got presenting to us today around working with athletes both in the elite area but also in an amateur environment from a private practice perspective. So thanks for joining us today, David.
Thanks, Alan. Thanks for having me. All right, guys, everyone, thanks for coming along. Thanks for joining in, and thanks for watching back on this online webinar. So hopefully I'll touch on a few things that will create some value, whether you're a private practice clinician. So I'm a private practice clinician here in Melbourne. Spend some time as a full-time clinician here in my own clinic, as well as spending some time in the VFLW at the Essendon Football Club. Spend some time in netball as well. So what we're going to touch on today is just some challenges we might face with the semi-elite, semi-professional, part-time athlete that we might be seeing inside a club or an organisation, but also some challenges we face in private clinic in terms of time we spend with the athletes. So just from that, so there's some of the brief background. So both in junior sport, so junior male sport with the TAC Northern Knights as a rehab coordinator, spent some time in women's sport with netball, some junior women's sport in terms of touring with the both the Australian netball team in the under 16s and the state Victorian team under 15. So a few differences there in terms of senior and junior athletes, male and female. So just on a bit of a recognition for the previous Vol webinars that have come before me, it's particularly in the female and the women's sports space. Some fantastic information there that are going to put me to shame. So almost the imposter syndrome for me following these guys up. So some great content there. So my thoughts are following more the practical tips. And so if you haven't seen these already, have a look at these and get some great information from those. And we'll follow a case study later on in today's presentation. So one of our athletes who's given me permission to share some of her information, some of her strength testing that we've done, and following on some of the work of Matt Bourne and the group there in terms of looking at the knee flexor eccentric issues that we follow after ACL, and some great resources we can follow on. Bit of a shout out to Randall Cooper and our mental blank here, Mr. Hughes, with the ACL rehab guide, so that criteria-based guidelines coming through. So, we use this extensively through the VFLW program, because we have had our fair share of athletes with some ACL injuries, or we've had some cross-coders come through with previous ACL issues, and some AFLW athletes coming back to the VFLW level with ACL. So being able to go through some criteria where we may not, in some private clinics, have full access to the full battery of testing we do in elite clubs, in elite sport. That's been a great resource to refer to as well. And also to take some of the pressure off in time versus criteria-based. So challenges. So from a private practice point of view, and also my role in the VFLW, often we're seeing athletes, we're inheriting them from different clubs where we don't have a great deal of background. We don't have a great depth of baseline measures, whether that be strengthening on things like NordBoard, whether that be hop testing, so any normative data there. Also in private clinic, also sometimes having the time to be able to assess somebody fully. We have our, whether it be 60-minute, 40-minute, 20-minute, half-hour appointments. So trying to get some of this information, but also getting baseline data is challenging or non-existent. So how we can work with that, and some things we've been able to do. But also if we don't have some of that equipment, sometimes some of the information we might miss. Using Matt Bourne's work, looking at that eccentric hamstring information that you may not get just by using handheld dynamometry and some other testing. So how we can be both time efficient and thorough, and not miss some of this information, knowing in AFLW, in VFLW, the recurrence rates with ACLs, second time injuries. It's certainly something we want to have some better depth of information on. And from that, the other challenge we have sometimes in private practice and some of the VFLW athletes coming through is they've been non-gym goers. So looking at some of their strength testing, looking at their 1, 3, 5 RMs, looking at squats, deadlifts, whatever it needs to be. Often in some of the untrained athletes, we're not necessarily getting meaningful data there all the time to warm them up in private clinic to go through and ascertain good information isn't always practical or feasible in the I guess restraints we have with both time and equipment and space availability. So there's some of the challenges. So from the VFLW athletes, we're going to about our 4th pre-season as we speak, with Melbourne reopening from COVID. So we've had a wide range of athletes coming through. So some cross-code athletes, both from soccer and hockey, who have represented Australia at the Olympics. We've had prior AFLW athletes coming back, either due to age or selection and list management. TAC aligned program coming through, so the Call to Cannons, so some sort of 17, 18-year-old athletes coming through. Some high-level athletes, like I said, some ex-Olympic Games, ex-Com Games athletes coming through who have had a long history inside the gym, through to our 17, 18-year-olds who haven't actually had a lot of exposure into gym training, but that's certainly changing in recent time. Through the local level players who have never been in high-level environment, I've never been in a high performance environment, and just some of the loading challenges we have in terms of getting their fitness level up and strength levels up without them getting overuse injuries. Age variance, so we do have a over 40-year-old on our list, one of our ex-Olympic athletes who's an absolute gem to work with, down through to 17-year-olds. Gym experience we've talked about, high performance program we've talked about. And the other challenge would be how much access we have. So having the athletes twice a week in the club, how much time we have between the physical preparation team, so physiotherapy, the rehab coordinators, the S&C team, the coaching requirements in terms of strategy, the coaching requirements in terms of skill acquisition, so some cross-coders who need as much hand-on footballs as possible and learning skills. There's often that competing agenda between where we sit. And like we've touched on already, the local private clinic, we're quite lucky in our clinic setup here, 10 consult rooms, 120 square metre gym space for rehab with cell matrix and a lot of your general equipment there, and a separate Pilates clinical exercise studio, so we've got space here. Also working some of our medical sites where we only have the one room. So some challenges there would be that, the gym access or equipment access we have, base level strength, how we get some baselines, how we actually test that with people who have never done a deadlift before in their life, and then just the expectations we have of culturally, how long they want to return to sport, that guaranteed 9-month, 12-month sort of mindset coming through. And even as Melbourne now coming out of COVID, we did have an instance with one of our players who's gone back to the surgeon and hasn't been inside a gym because all gyms have been closed for quite some time, who was cleared to return to sport, even though there are some significant deficits in their strength, lack of strength training, lack of high-speed running, things like that, was cleared to return to sport. So still sometimes there is that time-based criteria to return to sport rather than criteria-based criteria, funnily enough. So going back to Mick Hughes and Randall Cooper, and the Melbourne ACL guide is a great resource to have. Again, we're fortunate in the clinic when we set that up, we have access to the Nord board, the force frame, we have human track, we do have handheld dynamometry as well. So we do have all the kit through Vol. So thank you guys. That's been excellent for us to make some good decision making on the return coming through. And the last one that we touched on there is just the expectations with both the player, the family, the coach, and the surgeon, and time frames. And I think we're starting to see that's getting better as clinicians and the general community about what we need to do to minimise the risk of a second injury, but also the dropout rates out of sport, and how we in Melbourne or Victoria manage ACLs compared to Australia, compared to Europe, and non-surgical management as well. So with that, just looking at the action plan moving forward, we're again fortunate at the Bombers. Our head coach there comes from an S&C background, so he's got plenty of time for rehab, for physio and S&C to make sure our players come back. In private clinic, often we're wearing the hat of multiple people. We're the clinician, we're the rehabber, we're the performance coach as well. So just making sure we're not fall into the time pressures and date pressures to try and fit everything into one consult per month that a lot of our athletes would like to see, and making sure we're setting them up for success to get back to sport, to perform, not just to play, and they have some good options long term as we go. So all that said, that's a quick overview from me about some of the challenges, but it's exciting. Some exciting times ahead. There's been lots of movement in the AFLW space in regards to prep to play, footy first, ACL prevention, the FIFA 11 plus, some emerging things from there about where to fit the strength piece so we're not competing against the coaches, and the additional benefits of separating the strength piece in FIFA 11 plus the end of training for compliance reasons. Again, we were very, very fortunate at the Bombers with our coach and everybody being on the same page, and I was there basically from day one and be able to speak with the coaching about how we'd like to establish the program from the moment the girls walked into training all the way through to the time they were going out for warm-up, how that was best structured. So we're very, very lucky in that sense. Whereas in private clinic, if it's somebody from our local footy club coming through and we don't have that connection, there can be some challenges in terms of getting those things through. But I think more and more, listen to some of the sports physios and special sports physios discuss whatever's happening in the elite sports space generally later will trickle down to the local level as well, and basically whatever's done at AFL standard or NRL standard is replicated in community sport. So we're starting to see that that tide shift a little bit, which is great. So with all that, I thought we'll take you through a case review of one of our players who had given us permission to discuss her situation and some of the challenges we've faced in regards to VFLW seasons finishing, private clinic versus access through the club, and then COVID and the ring of steel around Melbourne versus Geelong, and be able to get access to players and access to gym equipment. So a little bit of a background, a little bit of a different one. So an ACL deficient athlete. So we went with conservative rehab. She did have an injury, a subsequent injury to that knee. We were able to go with a conservative approach after consulting with some specialist sports physios, some sports docs, and the like. We're able to return to play in 7 weeks for the final game of the season in 2019. So through that, had gone through the criteria based. For that, ticked off all the normal data, the hop testing, the battery testing, looking at strength testing and the like, and did very, very well with that. Looked at some isokinetic testing locally as well to look at our strength test, and all ticked off. The challenge we faced was that from that we then went into the off season, and in the start of the next pre-season, there was a second episode of instability, of which there was some meniscus involvement on that second time through. So after some further discussions with the medical team at the club, with the athlete, with some second opinions through physio and surgeons, and the sports doc, the decision was made to go through an ACL reconstruction and hamstring graft, which later happened in March. So between December and March, we had some good timing to do some rehabs and some prehabs, get the ball rolling to build up for success. So delving a bit further with this player, so long-term back pain since she was 14 years of age, and had been getting managed through the season for ongoing lower back, hip, groin, and pelvis issues. Self-confessed non-gym person, very much loved things like Pilates, loved yoga, didn't necessarily want to be seen in the gym. And what we have found has been some challenges with the squad coming through, particularly season 1, season 2, is some body image challenge in regards to doing heavy legs and some resistance with that. Keen runner, so would rather run than be seen inside the gym. So very much loves running, loves long distance running and the like. And like we see there at the bottom, gym, self-confessed non-gym person. So even building up some gym rehabs, some so for the conservative period, we negotiated pretty well there, set out our action plan and looked at some criteria, things would need to tick off to allow return to play, and highlighted our dates. And then going into looking at the reconstruction we had from December through to March to set up for success, and looking at what criteria we would like to have by the time we get into surgery. When surgery did roll around in middle of March, that was right in the middle of COVID times, so there were some limits in terms of gym and getting access to the player. So first little screen here is looking at this was more recent. So this was looking at the ISO prone. So looking at from a handheld dynamometry point of view, using the Nord board to look at some strength. We can sort of see there that's fairly reasonable, given that at this stage she had not been inside the gym for around about 4 or 5 months at this point in time. Just weren't able to access it through COVID lockdown. Bit of an asymmetry there. The max force and the torque there not amazing. But if we compare the concentric strength there into the Nordic, so here we're looking at where she was in December after the second incident. If we compare that to her eccentric strength 2 weeks ago, we can sort of see there some inhibition, so an imbalance of 57%. The torque not looking amazing. Her max strength there not great between left and right. So we sort of have a look through to yesterday. In fact, we're starting to see, after just two gym sessions with us, setting up some programs at home, we're starting to see her max force coming back up, starting to improve a little bit, which is good. And we can sort of see here that comparison. So reason for highlighting this is when we did on her first visit back after about a 4-month layoff, being able to access us because of that COVID and ring of steel, hop testing, normative data looked good. That sort of 90-95% left versus right was all pretty good. So the quality of her hopping wasn't fantastic. When we did her strength testing and she was doing some of her program at home, she felt concentrically she couldn't feel a significant difference one side over the other, which we could sort of see in that ISO prone. We would like to see her stronger overall left and right. But when we're able to highlight with her the eccentric strength and her inability to contract and contract well, and look at that imbalance in terms of where she was back in December, just a short period after her second incident, to where she was when she represented her strength coming down and that imbalance, and then 2 weeks later, great, much better buy-in from her about what we're trying to do and why we're trying to do these things, and just that nice reinforcement that the gym is the way forward to get her to return to perform, minimize her risk of whether it be subsequent hamstring issues or subsequent ACL issues. We can start showing her how these things are in fact improving. Sadly, we don't have that data between the December and the March period where her numbers were a lot better. Her newtons of force, her symmetry was a lot better prior to surgery, but done on a different machine. So with all this, I'll talk you through what we chose to do, what we have been doing, and where this player will sort of slot back into pre-season and her return to sport. So just some acknowledgements on the work I'm going to talk about. I'm definitely a clinician. I do love reading research. I do love reading the work of others and being inspired by that. So from that, big thank you to the Essendon Footy Club, Dave Rundle, to Nick Kane, Brady, Ash Lynch, and the presenters they'll bring in and support us in the VFLW program, the Sports Map Network, and Nick, and the multiple courses we've done through his program there, and the work that they've inspired us to do. Jack Hickey, and he came out through Vault and did a presentation to our clinic a few years ago on hamstring strain injury, and borrowing some of his imagery and slides and things that we've been able to use our athlete with. Jordan Mendeguccia, I do hope I've spelled that correctly. I've just added this just before this webinar. He's out to the Bombers and through the Sports Map and done our course and well published. Dave Opar, with Jack Hickey and a lot of his work there, and Andrew Wallace, who's presented through his program, the Hip and Groin Clinic, to our clinic a few times, and a few of his courses through the APA. So a lot of the work and a lot of the rehab we've been inspired from is from these guys. I'm not going to say it's my work, definitely not my work. Inspired by these guys and their colleagues and their research, of which they've done some amazing stuff. So we've basically stolen their work and so have adopted it and applied it to this athlete. So we can sort of see there, top left, looking at that hip versus knee dominant. So in that that initial phase with the athlete, seeing her concentric strength being quite good, but seeing her eccentric strength being down, looking at, okay, how do we build up some isometrics? How do we build up some XR sliders, some eccentric work to get that back up to regain from Andrew Bruder and Matt Bourne and those guys with that the knee flexor deficit? How can we get that in there? What we can sort of see down the bottom left there is from Jack Hickey's presentation to us, just looking at different positions between a knee dominant and a hip dominant. We wanted to maintain a mixture of the two. Number one, for this athlete with her lower back issues, coming from a Pilates background, her hip and groin issues, so co-managing her rehab needs. We wanted some hip dominant work for those pathologies. We also wanted some hip versus knee dominant in regards to the different muscle bundles that would be prioritize a high EMG work coming through. And then also just some easy things that whilst gyms were closed, that should be able to replicate at home using a coffee table, using a chair, using a Swiss ball, using some XR sliders, all those things that would be able to set her up for success. And so some of the rehab ideas come from the work here, which is born out of your hamstring injury data and your regeneration phases, your functional phases, and return to sport, pain-free, etc. So I've applied that effectively, and then looking at, well, how can we get this athlete building up whilst gyms are still closed for another 12 days down here in Victoria, down in Melbourne during COVID, and setting her up for success. And so some of the considerations were the equipment she would have access to. So we're able to set her up with some TRX, XR slides, and a Swiss ball for a lot of her program for her knee dominant and eccentric work. With the consideration of a bilateral versus unilateral, we've got her doing some tandem stance work with a stiff-legged deadlift to get that eccentric load through, but keeping her symmetry through her pelvis and through her spine. But also due to some of the lack of weight and load she has at home, we wanted to try and prioritize some unilateral work to get the torque up. Like we talked about, the knee dominant versus hip dominant based on her needs, based on her weakness levels highlight in the NORD board, based on which muscle groups you wanted to get through. I just love the whole quadrant of doom saying through that Jack talked about and Dave Opard talks about in terms of long and strong versus long and weak. So looking at building the eccentric program around that. And lastly, just considering with the rehab ideas, are we rehabbing an injured hamstring? Well, from a grafting point of view, you could argue that versus ACL rehab to help with the tibial control in that 20 to 30 degrees knee flexion angle, and then looking at what we're trying to target between the lateral group and medial group. And through Andrew Wallace's group, looking at the inhibition of short-headed biceps as long-headed biceps and just getting that area working well. So we can see some rep ranges down there. We just looked at our play and looked at what they were capable of doing with the equipment they had access to. So we didn't just follow a cookie cutter process. We just started based on where they were at and have built up over the last 2 weeks. And then just some reflection for us in private clinic in terms of which muscle group we're going to try and target in terms of the medial group on the lateral group, which exercise program is going to target which, and also for this player in particular, showing her some of the criteria where we wanted to get to, but in terms of our choice over which exercise we'll do and why we're doing that, and fitting that all back into her action plan and her treatment plan made a lot of sense to her. Seeing some of this imagery, talking her through the Melbourne Knee program criteria, looking at the VALD program, the information coming through, looking at a HOP test in the Melbourne program, but then looking at, yes, we do need you deadlifting. Yes, we do need you doing some of these things for these reasons. And again, just reiterating the need for some strength. And she bought in with that. She could see the advantage of doing one over the other. And Jan Lemur has just a nice summary of some great information, some great research out there in a way an athlete and the private clinic patient can see, and they just buy in a lot faster, helping work with that therapeutic alliance. So thank you with that, so what we were able to do is thank you for all the work of all the different physios and S&C coaches and specialists and surgeons out there who help educate us on our different choices. Having information out there in clinician land where we've got some great work from people who are sharing their data, sharing the information that we can pass on to our patients, pass on to our athletes is brilliant. Thank you to Vold for having their equipment available to us, so we can show to a patient that they do need to do some strength work. They do need to do more than just doing Pilates and the like, and here's the reasons for that. So some good data to show them that. And if we're accelerating their program and they're lacking some confidence, showing them that, hey, you are good to go. Your numbers are great. Your symmetry ratios are great. You're compared to where we would love your strength to be. You're ticking that box. So great, let's go through there and we can sort of compile that with their kinesiophobia scores and their return to sport scores for ACL on their PROMs, on their outcome measures. And yeah, so they're the main parts, and thank you for all the team at the Bombers, and in particular that early intervention through our head coach, having that discussion earlier about let's do some prevention work. So let's look at preventing ACLs, let's look at preventing hamstring injuries, male versus female athletes, but also speaking to the playing group, being the coaches, that we're doing this to make you the best athlete you can be, to run faster, jump higher. And if we can keep you out on the park, we're more likely to be successful. So the more you play, the more fun we have. We all play sport to have fun. And for us as physios, if there's less injured people, less for us to do, that's always a win, right? So it's, we're being very fortunate in a lot of ways at the Bombers to have some great athletes who are open-minded and happy to be guided. The challenging private practice is getting the local club when there's one player trying to come back. So educating the athlete, educating the coaches, and going one by one is a great way. And yeah, we're starting to see that, at least where we are in Victoria, starting to trickle through to our local clubs, understanding a bit more that prevention is key, and if it's not prevention, going through a good thorough rehab and being very specific in what we're doing and why we're doing that seems to help with a good action plan for each patient and each athlete. So there you go, Selwyn. So hopefully, mate, there's something there we can take away. And yeah, so there we go.
Thanks, David. A really intriguing insight into how you went about dealing with that ACL athlete, and definitely from my perspective, it's been interesting because recently there's been more discussion around the conservative management of ACL deficient athletes, and I'd be intrigued to know a little bit more around what were the key areas that you thought allowed that athlete to return to play within a 7-week period. Because did you find that there was an issue with the psychological component of the fear-based component of them returning knowing that they were ACL deficient, and how you address that?
Look, I think we were very fortunate with this athlete, with this case. I guess the copers versus the non-copers. She was somebody who was very much just happy to be guided by our sports doc, who is fantastic. So Michael Jamara through the footy club there, and being very happily to be guided by us and our team. So she very much said, look, inform me, tell me where I'm at, tell me what we need to do. So she sort of fell into that coping, loosely into that coping sort of athlete. And then being an isolated ACL, so the meniscus being intact, no chondral damage, was fantastic. So that certainly helped. Some of the challenges, probably her base level of strength, her base level of conditioning from a gym point of view, was less than we would have hoped. So we just spelled it out very early and said there's X number of weeks left in the season. We can try and target the last round, if not earlier. But here's the things we would recommend, we'd want you to be able to do and cope with. Here's the training load. So here's the aerobic capacity we need to keep you up with. Here's some high speed work we're going to need to substitute and modify. And whilst we're dealing with the somatosensory work around her knee and her coping with avoiding further incidents. And we just went through it with that using the Melbourne program, and just went through criteria in an accelerated way. And we went back to back to the evidence, back to the research, and looked at, well, what do we need to see? What are the case studies through NBA, through the EPL, of people who are able to return to sport non-surgically? Touch base with there's some great clinicians in Australia who are looking at surgical versus non-surgical management, and so lent through their ear and helped them inform us what we needed to do with Kieran Richardson, Jane Rooney, and Mick Hughes, and they were fantastic in helping frame our mind with their time and their assessment, both return to play and then after the subsequent injury, what we then needed to do.
And from your experience working with female athletes returning from ACL injury, you speak about some of those criteria for them to achieve. Is there certain criteria that you put greater weight to than others? I know that some of the hop testing or eccentric strength is commonly talked about, but is there one or two that you feel give you the best indication of how the athlete's coping, whether that be objective measurements or even field-based testing or completion of training?
Yeah, so again, we're fortunate at times to have the GPS units on the athletes. So I like to be able to see their speed, I like to be able to see the number of changes of directions in a session. So when they don't think we're looking and we are looking, just sort of seeing what they're doing when we're not there in the lab with them. So the normative data. So is their symmetry good? But how do they relate to what we'd like them to be at? And for me, confidence, I think, is the main one. And whether that be male or female, I think we're fairly lucky that some of our playing squad just puts a lot of trust into us. So they kind of, if we tick them off, they take great confidence with that. So I think a lot of even just, I guess, as you deal with athletes more and more, which is great in a sporting club, just asking them, how are you feeling? What's working? What's not working? Where do we need to, where aren't you confident yet? And we just put a lot more of our training around that. So if they're saying, look, I'm not confident landing yet, we do a lot more landing. Or if we're not confident change direction yet, we do a lot more of that. And then probably the last part is what position they play. If they're an inside mid, it's a lot of heavy body contact, a bit more exposure to body contact. If they're an aerial athlete, so a ruckman or a key forward who's jumping and landing a lot, we do a bit more of that. So we probably, I like to think we're guided a lot by the criteria out there, but we try and be as player specific and position specific as we can, and just having lots of good discussion with them, where they feel they're at, because there's things we'd like to see as physios and backfill. So like you said, are they high speed running? Are they changing direction like they used to? Hop testing is fantastic. I find a lot of our plays in the past using the Nord board purely hasn't been a great reference point for us, because they do score quite lowly. So we're doing a lot of work in that through season 2, season 3 to build that up. But yeah, year 1, year 2, that wasn't necessarily a great one for us. So speed and confidence.
Yeah, definitely. I think that confidence component and the psychosocial aspect of returning from a long-standing injury is really important to address. And you spoke about the pre-op strength that you put in a couple of months that you were able to work with this athlete. Are you able to give us just an insight around the focuses from that, and whether or not you believe that it would have had a more positive benefit if obviously COVID hadn't have happened?
Yeah, absolutely. So for a lot of it was setting her up for success post-surgery. So getting her eccentric strength up, looking at her comorbidities around her hips, her pelvis, lower back. So a lot of time and effort put in, well, what's the criteria you're going to need to pass to return to play in 9, 12, 15 months, whatever it ends up being, and starting that process very, very early, looking at that sort of isokinetic strengthening, your quads and hamstring that would look at. So prepping that well. So thinking that, well, whatever criteria we're going to need to pass down that, being functional towards those things. So we're preparing for that. And we were exposing to her hip dominant and knee dominant work around deadlifts, hip thrusts, her Bosch extender, because we didn't have access to a GHD, doing some ISOs in there as well, and getting the medial group and lateral group of her hamstrings as good as we could.
Yeah, excellent. And this athlete, you spoke about, they had a little bit of that fear of possibly strength training because of their history of low back and groin issues. Is there an element of using the data to just educate them on the necessity of strength training and how you go about using that sort of information? Or do you kind of, you showed the infographics from Young Lemieux, or do you lean on different components depending on the different personality type and, I guess, beliefs of the athlete?
Mate, nice. Probably a mixture of that. We found with the athlete in particular, very inquisitive, like to know more. On her own accord, she was going away and she started reading research. She comes from a marketing advertising background, so she was fully invested. She wanted to know more, so she was quite easy to deal with in that sense. We just sort of guided that and said, look, right now you're here. We'd love you to be here. Here's what we'd consider the normative data. So we want to start building you up. So her response was, okay, great, let's do that. And then looking at, what her preferences were. So we were able to get some Pilates work in there to maintain her lower back, using some of the DMA type work, using the reformers at the club. And so we're sort of working with her saying, well, we know you love Pilates, we know you like your yoga and your running. So here's a component of that we'd like to keep working with. Here's the criteria that we would say we'd like to see you improving on from a strength training point of view. Let's bring both worlds together. And she was really happy with that, working with her preferences, looking at, well, here's the outcome we want to get to, and here's a criteria we need to meet, knowing there's many which ways to skin a cat. She was really happy with that and was on board. So yeah, having her being interested in that was great.
And you highlighted some of the hamstring and eccentric work you've been doing that showed already some change to the imbalance. How many times a week are you exposing your athlete to that sort of training within an ACL rehabilitation context?
Yeah, currently with a few of the challenges, we're doing it 3 times per week. So we're able to get into clinic once per week at the moment in Melbourne, and restrictions are easing now. And twice a week at home, she's doing some of that work. So using some of her XR sliders, still doing some isometrics to build up her confidence. We haven't been keen to go straight to unilateral work with her XR sliders and her bridge slide outs just yet because of her pelvis and her control with that. But we've been able to find some ways to keep her stable, so to speak. Terrible word in physio, but to keep her stable, and then get as much loading as we can through the tissues that we want to work on. So yeah, 3 times a week.
Excellent. Like I mentioned before, David, really interesting insight into how you're using some of the objective data to inform decision making, but also to build engagement with athletes. And I think in that private clinical setting where you don't have the luxury of being with the athlete 6-7 times a week, it is important to build that buy-in as quickly as possible and as strongly as possible. And it sounds like you're doing some great work there in your practice. If anyone wanted to get in contact with you to discuss anything that you're currently doing in Melbourne, what's the best way to get in contact?
Yeah, look, email's great. So d.spithill@backinmotion.com.au. Just shoot me an email. Call the clinic. I'm on. The clinic has a Facebook page, so just jump in the DMs there and shoot us a message. But yeah, mate, like you said, we're pretty fortunate where we are, the access we have in our clinic, and be able to show our patients some bright and shiny graphs and where they're at, which they can then take home to show their parents who are sometimes paying the bill, or sometimes show the coach. This is why we need to progress. We just find it's quick, it's simple, easy to do. It has a lot of good meaning behind it for everyone involved.
Excellent. Well, all the best for the season ahead with the VFLW. Hopefully, you guys can play some football depending on what happens in Melbourne over the coming weeks. And thanks again for your time.
My pleasure. Thanks for having me along.